Every year, around 40,000 children in India are born with clubfoot, a condition where one or both feet turn inward. In this film, Santhosh brings to us the global context of clubfoot. And then, through Dr. Mathew Varghese, one of India's foremost orthopedic surgeons and a leading authority on clubfoot, we gain a clear understanding of the condition, what it is, why it happens, and how it can be fully treated.
So the guesstimate is around 40,000 children are born with a clubfoot in India every year. And in 2008, we did a study to understand why many children are not getting treated. And we realized there are a few things. One, training for doctors. Second, there's a special shoe that is required for the children. Third, this requires a long-term rehabilitation with special shoe. And then fourth, the documentation was not so strong in the government hospitals. So to fill this gap, a program was started. These are all the centers we have across India. We have 442 centers. These are all government medical colleges and government hospitals.
Clubfoot is a condition which the child is born with, does not acquire, born with a deformity of the foot, which causes the foot, normal foot is pointing forward. This causes the foot to turn in and like that. So what does this look like? This looks like a golf club. So it looks down and in and turned in like that. So that's like a club of golf. It is present from birth. 80 to 85% of this, the child will have no other problem except for this foot deformity present from birth. About 40% of them have both their feet turned in like that. Rest have only one foot turned in like that. The typical idiopathic clubfoot. So the term idiopathic is used by doctors for conditions where they will find no other reason for it, only one problem and nothing else is there. So 80 to 85% are idiopathic clubfoot. Is it genetic? No. However, sometime during the course of the growth of the baby in the mother's womb, it becomes tada. So can you diagnose it in the first 3 months of pregnancy? No. Can you diagnose it afterwards? Somewhere between 14 to 16 weeks, the ultrasound will show it.
मेरा बच्चे का नाम आरव है, मेरा नाम स्वीटी है। मेरा 1 साल 2 महीना हो गया बच्चे। जब पेट में था तब से मेरा बच्चे का पेट अड़ा था। फिर इसको इलाज करवाया मैंने, फिर प्लास्टर लगा, फिर चेरा लगा, फिर उसके बाद जूते लगा। जूते लगने के बाद अच्छे से इलाज चल रहा है।
So parents come to me, ultrasound diagnosis of clubfoot, should we terminate the pregnancy? So I said, come quickly, don't delay, I'll talk to you. So the doctor's job is to see, the ultrasound report will have several details to it. So the doctor's job is to see, is it with no other anomaly or is it just clubfoot? With just clubfoot, idiopathic, you can treat it completely, child walking normally, running normally, playing normally, doing everything normally. So when we talk about treatment by Ponseti's method, the most effective method for idiopathic clubfoot. Earlier they start the treatment, the better it is. The treatment is simple, by a plaster technique, not by surgery but by casting. So this technique, Ponseti's method, is unique. It's a non-surgical technique by serial plastering, which is not below the knee, which is not middle of the thigh, from the groin of the child to the toes. It's a long plaster with the knee held like this 90 degrees. And each time what we do, the doctor does the manipulation. So it's like this, it's not straight, this foot is not straight, it's been partially corrected. So we do the manipulation and see this, and I do this. And each time I keep correcting it. Now it looks better. So that's what we do. Manipulation and serial casting. So right from the time the child comes, you start it. So how often do you cast it? Every week. So each week a little more correction, each week a little more. So to start with, it is like this, second plaster is like this, third plaster is like this, fourth plaster is almost straight. By fifth plaster it starts going out. Then the deformity which is causing the heel to be up, equinus. The word equine, equestrian sport, comes from horses. So equine is the horses walk on their hooves. So these children, if uncorrected, they will walk on their toes. Equine. So that equinus is corrected by a small surgical procedure. That's never corrected by plastering. There is small surgical procedure. We do a small surgery here. It's a stitchless surgery done under local anesthesia. Can be done anywhere. In the OPD I do it, in a minor OT or in the theatre, but important thing is under local anesthesia, a small incision and a small cut. That dramatically corrects the foot to go up. Once sternotomy is done, the foot goes up completely straight. This cast is retained for 3 weeks. Once the 3 weeks are over, the 6th cast, that is 3 weeks are over, then the child is ready for a brace. The surgery ordeal is over. After 3 weeks of surgery, the child has the foot looking normal. But this normal looking foot has a nasty tendency to go back into the deformed position. That needs to be prevented, which is done by this brace. And the brace is unique. It has the feet turned out 70 degree. Parents start worrying, no, both feet are tied together 70 degree. There is no other way it can be maintained in the corrected position except by this brace. First 3 months, 23 hours a day.
जी, एक्सरसाइज करने के लिए बताइए डॉक्टर ने, सुबह और शाम आधे घंटे प्रोसेस बताया है करने के लिए, और बस यही बताया डॉक्टर साहब ने, और 23 घंटे जूते पहनाने के लिए बोला है।
कोई दवाइयाँ दी हैं?
नहीं, दवाई कुछ नहीं है।
After 3 months, the child has to have the brace during the sleeping period of the child, night time or daytime. The child has to be in a brace night time and nap time. We tell them as long as the sleep is on, the brace is on. How long? Till the baby is 5 years. So the child has to understand the brace is important. Parents have to understand brace is important. The grandparents have to understand.
पैदा होया था जब भी देख लिया था हमने इसका पैर मुड़ा हुआ, फिर हमने मेरठ दिखाया तो वहाँ प्लास्टर चढ़ाए 5, फिर इसके चीरा लगा, जूते दिए, फिर इसका पैर पक गया था, फिर जूते पहना नहीं पाए पूरे, तो इसका पैर जब तो सीधा हो गया था फिर दोबारा से मुड़ने लगा था.
Children, despite their trying to get the brace out, the deformity will come back. So many doctors advise surgery after that. No, it can again be corrected by Ponsonby's methods. So recurrences can be treated without surgery.
Awareness on clubfoot is the biggest challenge. Many parents think their child was born with polio. Clubfoot is not polio. Clubfoot is always by birth, whereas polio is after birth. Polio, we know the reason, so that's why we could prevent, we could stop. Whereas clubfoot, we do not know the reason. So we cannot blame father, mother, family for child being born with clubfoot. For every 800 live birth, one child is born with a clubfoot, and till today we do not know the reason.